morning, everyone, and welcome to our session on sustainable funding for vaccines. Thank you for joining us early in the morning on this Thursday of this year's European Health Forum Gashan. We've all spent the past 18 months discussing vaccinations quite extensively, but focusing understandably almost exclusively on COVID-19. However, in the first phase of the pandemic in particular, routine immunization programs for children and adults suffered as a result of the suspension in in-person services in many countries, with far-reaching implications. As we know, immunization affects more people than any other healthcare intervention globally, amounting to about 4 to 5 million deaths prevented each year. However, despite this proven effectiveness, the amount of funds dedicated to vaccines within healthcare budgets is relatively small. There is a recent study that was led by MSD that estimated that 20 out of 27 European countries spend less than 0.5% of their healthcare budget on vaccinations. And so it's very important for us to understand how this is decided and how this can change when the healthcare needs in the population change or when new vaccines come to market. Routine vaccinations are based on national immunization plans. Those are based usually on the recommendations of scientific bodies. So new vaccines, when they have access to the market, when they are approved for the market, they have the gateway to reimbursement as soon as they are included in these national immunization plans. So at this juncture, especially as we start thinking about how we might integrate COVID-19 vaccines moving forward into national immunization plans, it's important to try and think about how much funding we invest in vaccines and how we can make that sustainable, particularly with the view of the contribution of immunization to health systems resilience and the consideration of equitable access across European countries. Until now, even though there is quite a bit of research that has looked at other elements, we here at the Observatory, for example, carried out a study a couple of years ago, and we found that there is a considerable variation across European countries in the governance, provision, and financing of vaccination services. However, the exact mechanisms that determine vaccination budgets and what that may mean for access in European countries had not been explored in detail until now. So this gap has been bridged recently by a comparative analysis across 8 European countries about how decisions are made that determine vaccine budget. And this is the catalyst for our session here today. What we want to do with you this morning and with our esteemed panelists, we want to hear the main results from this comparative study about how budgets for vaccines are determined and review differences with the link to access to vaccination in different European countries and what this means for routine vaccination programs moving forward. We also want to discuss opportunities to ensure adequate and sustainable funding for existing and new vaccines in the post-pandemic context that we hopefully enter at some point, and as an integral part of health systems resilience and pandemic preparedness plans in the future. To do that, we have an excellent group of panelists today. We have Tim Wilson, who is the Vice President and Head of Policy in the Life Science practice of Charles River Associates. Tim was the lead in the study that I mentioned, the comparative study across 8 European countries on budget for vaccines, and will give us the keynote presentation. Tim can also reflect from a number of different perspectives. He has done broad range work on vaccinations in the past, so it will be a pleasure to hear what you found, Tim, and put it in context. Once we've heard from Tim, we have 4 panelists with us today to discuss the implications of the findings of this comparative study on how we fund vaccines so far and what we can do in the future. We have the State Secretary for Health of Romania, Andrei Baciu. He will give us the perspective from Romania, challenges, opportunities, and what he thinks can be done in the future. We have Richard Bergström, who is Sweden's vaccine coordinator. He will bring the Swedish perspective and the broader Nordic perspective, but Richard was also the head of FPA in the past, so he can bring also the industry perspective and clearly also the European perspective from international collaboration. For the European perspective, we also have Raluca Painter, who leads the unit of non-labor market, education, health and social services at the European Commission's DG Reform. And she can also talk to us about what she thinks, where she thinks that the Commission can support member states in ensuring sustainable and equitable funding for vaccines in the future. Last but not least, we have Mariano Vota from Italy joining us. He's the director of the Active Citizenship Network and will bring both the civil society and the Italian perspective into the panel. So as you see, a broad range of perspective, excellent speakers. So we're really excited to have you with us today, and we thank you for being here once again. So what we also want to do is to draw on your experiences and your insights. So we'll engage you through different means throughout the session with polls, with word clouds, and with a Q&A and chat functions. So my colleague Ryan Lawler is the chat moderator for today. He will be keeping an eye on both Q&A and chat and make sure that he feeds back to us on the panel your insights and your inputs. Please use the Q&A, both of them you can see at the bottom of your screen. Use the Q&A to put questions to the panelists, either to specific panelists or to the panel as a whole. Use the chat for any other comments. If you want to share, for example, material based on your experience, if you want to write about your experience, this is an excellent place to put it. And so we would like to ask you to keep an eye on what is going on and help us with contributing through these means. We have structured the session as follows. We will hear from Tim, his short keynote presentation in the beginning, followed by reflections from our panelists on existing challenges with vaccines funding and what we can do to overcome them. And then we will move into a second part of the panel discussion, which has to do primarily with what we have learned from the COVID-19 pandemic. How can we look forward going out of the pandemic to ensure sustainable and equitable funding for vaccines in the future? Let's kick it off. Without further ado, I said that we really want to include you all into the session and into how the discussion is shaped. So we would like to start even before the keynote with hearing from you via word cloud. So we have a question that you see on the screen. What do you think is important for ensuring sustainable approach to vaccine budgeting? Most important parameters for achieving sustainable budgets for vaccines. We have the first: global equality, cooperation, transparency, trust, no spending caps, okay? Prioritization based on public health needs, very nice. We have 3 people who have had their coffee already and have given us some input, 4, 6. Cooperation and prioritization are gaining traction here. Now 9 people are awake, that's great. We are aiming for all 57 to be awake and following us and ready to hear the keynote messages from Tim. We do see here cooperation. I think this is the most frequently used one, as we can tell from the size of the letters. It's interesting to talk about later during the session what we understand under this term, if this is cross-country collaboration, if this is stakeholder collaboration within a given healthcare system. Transparency and trust, also very prominent. Political will is new. All right, I think this is already excellent. We have about 22 participants. Let's wait until we have at least half, I would say. This is great. So I think for me, it's very interesting that cooperation still has first place, and we see really key concepts to take them moving forward into the discussion: political will, transparency, cooperation, prioritization, trust, and no spending caps. So I think I'll take this cue, the no spending caps, to introduce Tim's presentation that will maybe shed a little bit of light on how this issue of whether spending is closed or open looks like in different countries in Europe. So I think if we can save the word cloud and perhaps look back at it later during the discussion, that would be great. I'm not sure whether via Slido you can still participate later on, but we have other engagement opportunities, so this should be okay. So thank you very much for participating in the word cloud. No spending caps on top of the red highlighted bits here in the cloud. Tim, over to you. enlighten us to what extent spending caps actually exist. No, of course not. This is a much broader analysis, but please give us your insights from your recent work about how budgets for vaccines are set in Europe. Over to you.
Thanks, Timmy. I thought that word cloud was excellent. And when we come to my last slide, we might want to at least mentally compare some of the elements of the word cloud to some of our conclusions. So that was a very helpful start to the session, especially as everyone's waking up today. So what I want to take us through is a piece of analysis. We haven't yet published, so this is the first time we'll get to present the results and just give you a high-level review of it today, and then looking forward to the comments of the panel, but also the comments we get through the chat. So if we move to the next slide. As Dimi said, there's a lot of studies already existing on how much we spend, or we've recently had a number of studies on how much we spend on vaccines. There's very good studies on the decision-making process and evidence and the structure of which we decide that vaccines are introduced into immunization plans. There's much less focus on the question of how we decide how much money to spend or allocate to vaccines and the process for doing that. So this did seem an area where there was relatively little research, and obviously given the experience of the last 18 months and the budgetary consequences of that, a really key question for European economies today, but also particularly going forward. So Sanofi asked CRA to do some research on this. We would love to have done all the markets in Europe. We chose to do 8 markets, which both gave us a range of different healthcare systems, a range of different approaches to procurement, and obviously procurement follows and is very connected to the funding system, and different levels of transparency. So we included England, Finland, France, Germany, Italy, Norway, Romania, and Spain. Not Sweden, unfortunately, Richard. So it'd be interesting to see where you think it fits into this framework. We then started from a literature review, as you often do in an area which hasn't got much of a literature to date. And the framework was really to say, well, who's involved in that process, but how is the decision made, and how does this fit in to questions of procurement, purchasing, and access, which are obviously key issues. But also, how does this change over time? So it's all very well to look at the vaccine budget today and see where it's situated, but how does this change? And that obviously links with some of the big implications we're going to have over the next couple of years, both because of economic factors, but also as spending on COVID vaccines is incorporated into the vaccines budgets. We did a mapping exercise, so we in the final publication, you will see quite detailed analysis of each of the 8 markets, looking at what we can say about the amount of spending, what we can say about the different stakeholders involved. I'm not going to go through a lot of that, people will be relieved today, but in the final report you will see quantification as well as some of the qualitative results. And then, and I think this is really the important bit, is we try to compare countries, and to compare countries we need a standardized framework, a standardized terminology, a taxonomy, and then we need to look at the pros and cons of those. So that's where we did interviews with local market experts to say, given the way that funding is determined in your country, what are the pros and cons of these? And we started, as we're economists, we started with a set of hypotheses and then tested those but through these interviews. And again, not a huge number of interviews we did, so it would be interesting to get people's reflections on that, but we've got a set of pros and cons. So the interviews were a mixture of policymakers, policy advisors, public payers, and academics. So we got a range of different perspectives. Right. So what did we actually find? So if you move to the next slide, well, the first thing we found is if you compare different countries, you can get very detailed descriptions of how funding is determined, but they look incredibly different when you compare one to another. The structure of the healthcare system as well as the stakeholders are very different. So we need some way of putting some structure on this comparison. So we decided that it was useful to compare, one, the budget structure. How does the vaccines budget fit into the healthcare budget? And secondly, the budget setting process. How does this change over time? So this element of where does it fit today? How does it change? So if you focus on the left-hand side of this chart, we then, if you think about the budget structure, we saw there were three big differences. There's many nuances, but three big differences in how countries were structuring their vaccines budget. One was whether it was situated within the healthcare spending overall or part of the prevention public health budget. So whether it was included within an overall compass of healthcare spending or within prevention. Secondly, whether the granularity. So was there a budget line, a budget item for the vaccines budget, or was this part of that global budget? So even within the overall spending, did we have a line for vaccines? That will turn out to be quite important as we come to transparency. And then, is this based on an annual budget? This is determined ex ante, if you're the economists in the room, or is it determined ex post? Is it determined by what we need in that year? So is it a planned expenditure, or is it pay as you go? And these dimensions vary. For each of the countries, we went through those dimensions. There is some correlation between the ones on the left and the ones on the right. So we've grouped these together and we've said ones which are, it's about public spending with a vaccines budget, an annual plan we call closed. Ones where it's within healthcare, flexibility, it's a global budget, pay as you go, ex post, we've called open. We can see whether that's a useful terminology as we go through. So that's where the budget sits in any given year. How does it change? So focus on the right-hand side of this chart. So who determines it? Is it a centralized process? Ministry of Health, often talking to the Department of Social Security, maybe the Ministry of Finance as well. Is that the determination that sets the budget each year? Or is it a decentralized process made up from more the regional health authorities and feeds up into a budget determination? So is it a centralized process or a decentralized process? Does it change based on rules, how the population is changing, how the volume we're expecting to change, trends in the data, so we extrapolate future trends? Or is it based on aspirations, the performance level, new coverage targets, where we'd like to get to in terms of coverage targets? And then how does it anticipate future needs? Is this one where we do horizon scanning and we have an approach to thinking what's going to happen in the next couple of years? Or is this one where, well, we will have a fund that changes over time, but reflects demand? So on the left, again, different countries may be in different positions on these different dimensions, but there's a correlation between them. So decentralized, based on trends, as needed, we've called ad hoc. On the right-hand side, a more centralized process where we're focusing on aspiration, we're looking forward, we've called dynamic. So that's our framework. If we move to the next slide to bring this to life, what we've tried to do, and this is where it will probably get controversial, is put countries into those four quadrants. And I won't go through all of them, but if we look at some examples. So in my own country, the UK, we have a more restricted Section 7A budget within focusing on immunisation, but we have a horizon scanning process. So it does look forward in terms of what's going to happen. So we call that a closed dynamic system. Contrast that to Germany, where it's part of the healthcare overall budget. There's a commitment to fund anything that's recommended. So it's by definition dynamic. So we call that an open dynamic system. If we look to France, it's within the overall healthcare spending, but there's an annual budget that moves and changes based on trends over time in what we've called an ad hoc fashion. So ad hoc, open. And then I'll choose Romania, given Dr. Bashu's on the panel. We have a budget within the prevention budget, but this is where it's based on an annual process based on ad hoc adjustments. There's no forward-looking aspect to it in terms of the literature and interviews we've done. So we're hoping that these countries kind of fit into these 4 quadrants. It's stylization, as any model is, but this is hopefully a useful way of comparing and contrasting different markets.
Can I interrupt briefly here? Just to see where our audience is and what our audience thinks, I will have to admit from my side, I would not have known before hearing you talk about this, where my country would fit on the map. So I'm really interested to know, because this is not an area that we've talked about a lot before. So I'm interested to know from our participants, a very easy question. Would you know, do you know where your country would fit on this matrix if you're not from one of the countries that Tim just talked about? Now you know if you are from one of those countries, but would you have known this? It's an interesting question, I think, for policymakers and scientists alike, because this is, if not clearly under research, but also an under communicated area.
Perfect. It's going to be fascinating. I've just submitted my answer, which is slightly cheating given we've done the analysis, but
yes,
it'll be fascinating to see everybody else's response.
But you are in the minority, Tim. You are.
Well,
we have 20% yes and 80% no, from 36 out of our 65, including you, 66 participants. And I think we can. I think you can start. I think we can keep voting. I hope that is the case. But we almost have 40 participants now, and it's even 18, 20, 18, 82. 18 yes, 82 no. So very well placed your study, Tim, for an existing gap in information and in knowledge. If only it was 28 instead of 8 countries, you could have worked on it probably for another 5 years. Maybe you would have managed to put this together. But all right. So thank you very much to all of our participants who voted for this. We close the poll for now. Let's say we have 20% yes, 80% no. So I don't feel alone, which is great. All right. So Tim, you also looked at what the possible advantages and disadvantages of these methods are, correct?
That's right.
Yes.
So if we move to the next slide. So what we did here was we first of all started with us conceptually thinking whether these were a good or a bad thing, and as economists do, coming up with a set of theories. What you're going to see on the slides today is very much informed by the interviews we did. So if you think about this top left market illustrated by the UK, so it has some advantages that we can see the budget and we can monitor it over time. It has flexibility, so it's not actually setting a cap. It can be overspent. So there's an element. Oh, sorry, Richard. Probably need to whoever just go on to mute. One of the interesting things about this is because we've got a budget focused on vaccines, we're anticipating a high level of transparency. But what we found in the interviews was even if you've got horizon scanning, we don't necessarily understand how that fits into future budgets. So this is an interesting aspect here, that one that you would think is transparent, set fund, horizon scanning, even there we had a lack of transparency. If we go to the next one. In Germany, and this obviously changes over time, it's within the overall healthcare budget, great flexibility. Everyone recognized that in the interviews. But what you do when you start to analyze this is, well, how do we monitor spending going over time? When you start to talk to the policymakers, well, how do we know that we're actually spending money in the right places? So although we've got a dynamic system, a flexible system, do we have the control to monitor spending? If we move to the next one. Well, here, and this is where we put Romania, actually it's seen as an advantage of having ring-fence funding, and particularly when there's pressure on funding and funding is being drawn for other purposes, there's a danger that the vaccines budget gets reduced. So actually ring-fencing is an advantage when budgets are under pressure. That gives you some degree of transparency. It's in a closed system. But obviously the disadvantage of this is when demand changes. and this is obviously very interesting thinking about the future years with the COVID vaccines. So how do you cope with this? This is how do you respond to this in a thoughtful way, rather than adjusting based on populations and historical data and actually see limitations on access. So it has some advantages, but also has some disadvantages. And then the final one, which we used as the French system, here as part of the overall healthcare spending, that obviously has some big advantages when health spending on vaccines increases. You have a much wider budget envelope. Vaccine spending is diluted in terms of political focus anyway, and that gives you a great degree of flexibility. The problem obviously here is the level of transparency in terms of current spending and whether current spending aligns with need. So what you see in all of these cases, and this wasn't in our theoretical case, I suppose we thought there would be clearly some advantages in terms of transparency in some versus others. There are issues in transparency across all four quadrants. There's no perfect way of doing this. The second thing you see is how these respond to shocks and changes is asymmetric. Some of these systems work better when demand is increasing and you have a wide budget envelope when you've got horizon scanning. Some of these systems work better to defend vaccines when you've got pressure on budgets. So again, it depends on the nature of the pressures on the vaccine spending as to the advantages and disadvantages of the system. So if we move to our final slide, and I will wrap up. So what do we learn from this? Well, I suppose when we went into this, we'd loved there to have been a perfect system so that everyone can move to this system. And we don't find that. We find all the systems have advantages and disadvantages, but we do find these common principles. One, we need prioritization and a link between the funding and the recommendations that are coming out. Otherwise, we end up with vaccines being recommended but not funded, and that's a worse situation for patients. Whatever system we have, it needs to be forward-looking. That can be through horizon scanning, 3-4 years, or it can just be having multi-year plans. And multi-year plans obviously force us to think about the future in a similar way. So you can do that in different ways, but we need to be looking at this in the long term. Remember that word cloud. We need to be adjusting spending not based on historical trends. We've all learned this over the last 18 months, but on what we need. So we need to think about outcomes, performance, new vaccines coming into the market. Even if we have a budget, that doesn't mean we should limit spending if there's a very good reason for flexibility. We need to manage healthcare spending, we all know. But again, linking to the word cloud earlier on, we would agree. We can have budgets, we can have monitoring, but they shouldn't be strict caps. We should have adjustments through the year. We shouldn't have to wait to the next budget cycle. And then even if you don't have a vaccines line in your annual plan, we can monitor and report vaccine spending. We can break the link between a plan and monitoring. And that seems really important. It goes to some of those studies looking at the amount we spend on vaccines. That's useful to compare across countries, independent of whether we're having a line item plan for vaccine spending. And finally, and hopefully this study is the start of this, we need to compare markets and learn best practice lessons. This is obviously where the EU can play a role, but also sessions like this at Gastein and the discussion we're going to have that will follow. So I'll wrap it up there, Dimi, and look forward to the comments that follow.
Thank you very much, Tim. I think, just a second. This was really, really informative, and particularly given the short poll that we had, probably new information for a lot of our participants, or even if it's not brand new information, at least I think it structures the way we think about vaccines budget in a very useful way. I just want to reflect back. I mean, I think on your key principles on the last slide, the only principle from the word cloud that wasn't there, as far as I could see, was equity, and I think that's just because this was a broader goal of the study, but not one of your key principles, as you mentioned it. Otherwise, the big five of the word cloud were cooperation, trust, transparency, no budget caps, and equity. And I think probably we are very close to where you are. When we talk about equity, I think within your study, we can think about this difference between European countries and what the different modalities might mean for access to vaccines, and how this, from a European perspective, might not be equal or equitable across the countries. But we can also think which was not the focus of your study, but within country issues. For example, if there's cost sharing for vaccines, then for some they might be affordable and for others they might not be affordable. So maybe we can bring this with us later in the discussion. What we would like to do now, if that's okay with you, Tim, I'm not coming back to you right now. We'll bring you back in for the panel discussion because we want to hear reflections from our panelists on Tim's presentation, on the differences between countries and on the key messages. And our thoughts are to start with the Secretary of State of Romania, Mr. Baciu. I hope you are here. I know you connected earlier and we're really grateful to have you. So if you would like to share with us your reflections about how you see the budget setting process for vaccines in Romania, what the challenges have been. I understand you introduced changes recently, how they have progressed and what they have meant, and how you see that for the future. We'd be very grateful. Over to you. Thank you for joining us.
Thank you so much for the kind invitation. I hope you can hear me. If you could confirm, please.
We can hear you just fine. Thank you.
So indeed, I believe that this is a great topic to discuss, to address, because of course, vaccine accessibility depends on budgetary allocation. And we've seen the efforts that the European Commission has made for in order to facilitate the access to the very early access to vaccination for all member states, including, of course, Romania. So here we managed to indeed to find the best way to procure the vaccines. But I believe that this kind of analysis, in order to align practices of member states or at the European region, is extremely important, because otherwise delays in vaccine procurement might arrive if there is no rapid response. So your analysis, I think, provides great incentives and great insights regarding the best approach for the next years to come. We're looking at different models, of course, with advantages and disadvantages. But what I believe that should be a top priority is finding a way of providing a flexible and sustainable budget for vaccine allocation in order for all the European patients to have immediate access to the only cure, actually, the only scientific solution, approved and evidence-based solution that can end this pandemic. So, of course, adapting it to the European models, to the European standards, would be much more feasible for countries like Romania, which are developing and trying to develop as soon as possible more efficient models of vaccination through the whole general population.
Thank you very much. Do you, may I ask about, next to the COVID-19 vaccines, what we've been thinking about and briefly talked about at the beginning of the session is this idea that if COVID-19 vaccinations are to be integrated into the routine vaccination plans in the next few years, this might mean less funding for other vaccines in the routine vaccination plan. So if you think about vaccination beyond COVID-19, maybe reflect for us the situation in Romania, or where you see challenges and opportunities for the future. Thank you.
It's a great question. What I believe is that all health policies should be patient-centered, not budgetary-centered. So if patients need and can benefit from a certain medical solution, in our case a vaccine, then of course patients should be at the center of our health policies and our decisions. Of course, there's no return on investment in the healthcare sector other than a healthy population, an active population that has the means to keep the social and economic life of a society. So I do believe that we should keep in mind patient-centered.
Thank you very much, Secretary of State Baciu. I think this reflects very well what we saw also in a word cloud participation from the audience, this idea of prioritization. And this for me also means prioritizing vaccines clearly within the healthcare budget. And I think, as you say, if we take a patient-centered approach, this is one of the areas definitely to have in focus. I understand that you cannot stay for the duration of the panel, and we're very grateful that you could make the time even to join us today. Do you have any additional points that you want to make at this stage before you have to leave us?
Of course, yes, it's a great panel. It's a great discussion. I have colleagues that will keep me posted with everything that is going, everything discussed. I apologize for not being able to stay more, but what I still consider is that only together we can end this pandemic. We should do all the efforts, and unfortunately, as we see in other continents, and most likely can be a challenge for European member states for the next year, are the financial allocation, the budgetary restrictions. So in order to overcome this challenge, this topic today, discussion and this analysis, I believe that will be providing the best solution for our patients to have immediate access to treatment that can save their lives. So only together we can act and find the best solution to end this pandemic and find a sustainable and flexible dynamic model, financing model for vaccines all over Europe.
Thank you very much, Secretary of Sărbaciu. I think this is also a very important aspect that the audience clearly agrees with. Cooperation and collaboration was also very prominent, and I'm very happy to hear that you support that as well. We thank you. We wish you a fruitful rest of your day, and very happy to pick up any additional messages from your staff or from you over the course of the panel. We have different methods for that to happen. Thank you very much. And I would like, since Secretary of State Paciu mentioned this issue of cooperation and collaboration, I would like to move to the Commission. This European perspective of supporting member states with perhaps also their reforms, with changing the way they do things. This is the mission of DG Reform. So Raluca, I come to you with this question. I mean, Tim showed us the variation, even in a relatively limited sample of European countries already, quite a lot of variation in the way that vaccine budgets are set. And so your job, if I may say this simply, is in part to support member states who come to you and who say, we want to implement this change. We want to think about this issue. How does this make life harder for you that is so different across member states? Where do you see the role of DG Reform in supporting member states in this area? Over to you. Thank you.
Thank you, Dimitra. Good morning, everybody. I'd like to thank Tim for the very interesting presentation, which indeed highlighted the different approaches of member states. And what I would like to put forward today is the mission of this Director General of the Commission that supports reforms in the member states, because our mandate is not only in relation to helping member states overcome the crisis and prepare and implement the recovery and resilience plans, but it is for the longer term. And enhancing the resilience and sustainability of health systems across the EU is one of the key objectives of DG Reform. Our approach is really driven by demand. So we intervene where there is one of the member states is asking for support, and we're engaging with member states administrations, so ministries of health, health insurance, public health authorities of national level, but also regional and local level. So the key is also to put around the table a broad range of stakeholders. And when we discuss one topic, to really identify all the relevant stakeholders. So because we're demand driven, then we define with the member states the scope of intervention. But as I said, putting everybody around the table, I think, is one of the key features that help dialogue and help identify solutions that work for the longer term, because we know it's the ownership, the engagement of all the parties is very important when you want to do reforms that have an impact for the longer term. So maybe just to give some examples of areas of intervention. So for example, disease prevention, health promotion, a lot on digitalization of health systems, performance assessment, financing and reimbursement mechanisms, and quality of care are some of the areas in which we intervene. We know, for example, now we're talking about vaccination, many diseases are preventable and can be diagnosed early before a patient is in need of treatment. So we do believe that citizens should benefit from holistic public health policies and have access to disease prevention and health promotion services. That's why we encourage member states to come to us to ask for support in these areas, because through the intervention of DG reform, which consists not in giving money to member states, but putting at their disposal the best provider of expertise, being a European organization, international organization like WHO, universities, academia, or private consultancies or consortium of providers. This is what we offer. And through this support, we really enable authorities to set strategic governance and technical frameworks in order to ensure efficient transformation of public health, promoting good health, and preventing diseases. So, for example, we're working, we have projects on to enable better cancer screening, to tackle shortages of medicines in certain areas. So this is just to illustrate a bit the variety of areas where we intervene. Of course, I mean, strategies for vaccination following the COVID crisis, that would be an interesting area where we would be indeed very happy to work with member states. But maybe we come to this at a later stage. Right now, I just wanted to highlight the demand-driven support that we offer, the fact that we look at the Commission to identify the best expert for any given project, and the fact that we are open to support member states, including in the area of vaccination. Thank you very much.
Thank you very much, Raluca. I think this is really important, and to put it very plainly for our participants, this means member states who need help, they come to you and ask you to help them. This is the way things work. You don't go to the member states yourself. They come to ask you for help. And as you pointed out, you know, very importantly, this area of vaccination, important for the next years already, but also in light of the post-pandemic situation. And I think it also links very well what you just said, you know, bringing part of the mission of DG Reform being bringing the best experts around the table to discuss possibilities. And the best way forward links to Tim's presentation for me, because we see how different practices are. So if we think about this idea of understanding how different practices influence access, this is also an excellent opportunity for cross-country learning. So perhaps around the table sit the experts from other countries who do it differently, and then can maybe bring ideas and support. And we come back to how specifically this can look like for vaccination programs in the future, as you said, further down during the discussion. For now, I would like to go to Sweden and to Richard. Richard, you heard the categorization that Tim presented. You have a very clear view of where things are with vaccines in Sweden, where how European collaboration has worked for the COVID-19 vaccines. So give us a couple of comments of on what you've heard so far.
So, hello everybody, good morning. Thank you for the invitation. This is a topic where I could probably speak the whole day, if not more. Having, as you said, Dean, in your introduction, you know, I used to work for FBI here in Brussels, where I'm right now, actually. But I'm now the government coordinator for COVID-19 vaccines in Sweden. But spending most of my time actually together with all my EU colleagues. So I'm part of the steering board and part of the negotiation team that landed us with more than 3 billion doses of vaccines. I mean, keep in mind, they have not been made yet. This is sometimes a misperception in the press. It's like we have some kind of warehouse somewhere where we're hiding the vaccines for the world. That's not the case. I think we all working on vaccines have a duty to explain that to everybody, you know, that these vaccines are reserved. And in fact, they have been developed thanks to government intervention. And so the observations I'd like to make here, and I'll try and keep it short, is that first of all, having a background in pharma, and having promoted the concept of value-based pricing, value-based healthcare, vaccines in a way could be a role model for other medicines. Because as Tim showed in his excellent research, which I would love to see expanded, by the way, to more countries. So by the way, Sanofi, I hope you can pick up the tab for that, the expansion of the study. Thanks for the sponsorship of the report and this session, first of all. But so it's interesting that, you know, some countries have this approach, and Sweden is similar, that once you have recommended something, then you will find the money. We don't do that for other therapeutic areas, actually. So I think from a general pharma perspective, it's a very interesting approach. Also, I think health economics was used very, very early in the vaccine space. So on the one hand, you know, vaccine space, it could be a role model and inspiration for the rest of pharma and medicines. But unfortunately, the realities are also that it's very passive. And now I may step on some toes, but if you reflect on it, would we have had these COVID-19 vaccines if we would have gone about things the usual way? No. Because the way the whole vaccine system has been working is that you sit and wait for things to be developed by the private sector primarily. There may be some public-private partnerships, there may be some Horizon Europe money, there might be some NIH money, there might be BARDA money involved, right? But essentially, the people in charge of the vaccination programs are waiting. There's been one exception, I think, only to my knowledge, which is when Gavi, the global coalition, actually put money on the table and did a kind of an innovation procurement for a pediatric vaccine. Okay, now that to my knowledge that happened once, so we haven't seen the type of mobilization before as we've seen now with the COVID-19 vaccines. And essentially what happened was that the European, both in the US with the Operation Warp Speed, in the UK with their own task force, and here in EU with the European Commission setting up the steering board and a process to arrive at advanced purchase agreements. If that wouldn't have happened, we wouldn't have these vaccines. So the whole vaccine system is not built, I would say, to actually drive and promote innovation. And some colleagues on the call here, I'm sure, will remember discussions that we had in Brussels years ago about the need to maybe move to next generation flu vaccines. You know, the flu vaccines are today made primarily using egg-based production, chicken eggs that you use for production. And it's very cost effective, you know, it's big scale, everything's fine. But some of us said years ago that shouldn't we try and move to the next level technology? How about the governments putting money on the table and say, we want you to come up with something which is a bit faster, new, less sensitive, because if you have an avian flu, you can imagine that you're not going to get any chicken eggs, right? So there were some sensitivities in the system. So we said, why don't you just say, okay, we're going to pay not 3 or not 4, but maybe 8 euros a dose, money on the table, go figure something out. Well, now what's happened is that thanks to COVID-19, we have now technology breakthroughs, both with adenovirus vector vaccines, and in particular the mRNA vaccines, which are the big ones here in Europe, you know, Moderna and Pfizer. And there, you know, now people are talking about combining COVID-19 booster shot with the flu vaccine. So the technology push happened, but it happened thanks to a public intervention. The private sector played along very, very well, you know, extremely well, and it sort of accepted to do the tango together with the public sector. But it's very important as part that these budgets are not viewed simply as something passively to procure things that were developed by somebody else, but actually actively taking part in driving the innovation, kind of an innovation procurement in a sense, you know, that you say what you want and you drive that. So I'll pause there. Happy to come back later in the conversation.
Yes. I was about to say, keep that thought, because in the later part of the conversation, we will discuss exactly how we move on to new models, perhaps going out of the pandemics, hopefully for sustainable funding for vaccines. And I will ask you if you think what happened with COVID-19 vaccines is sustainable for other new vaccines in the future, the type of model that we can use. You mentioned already, I think, the direction of your thinking, but I will ask you to elaborate, hold that thought for later. Thank you very much. Last but not least, for this first round of interventions, we go to Mariano. Mariano, you bring us the Italian perspective, but also the active citizenship perspective. So from your side, this whole idea of budgeting for vaccines, perhaps insufficient budgeting for vaccines, depending on the country, how do you see that?
Good morning, and thanks a lot for the kind invitation. That's my comment takes inspiration, Dimitra, from the keywords already shared at the very beginning of this event, before the presentation of the research, the benchmark research. Political will, transparency, no spending caps. Later on, if I have the opportunity, I'd like also to discuss about prioritization and cooperation / participation. Political will, we have to face one of the main challenges, the discrepancy of perspective between the expert who suggests a medium long-term solution, like the National Immunization Technical Advisory Group, and the short-term vision of the politicians, the political class, we can say. In Italy, 66 different governments from in the last 50 years, an average life of each government less than 1 year. This is a key element to take in consideration. If we don't mention this element that has strong impact, we can probably do not identify also who is in charge to take some responsibility and some final decision. This is an extremely relevant point, according to me. One of the risks, if you take in consideration this aspect, is too much simplification. The second one is linked with transparency, and I can add also accountability, and to promote more transparency, but please consider that transparency is a univocal attitude and request. So if we need more transparency according to the vaccine expenditure budget, we can also identify more work to work towards more transparency in terms of the purchase. And what has happened last years, it was not 100% on transparency when we discuss according to the contract signed by the European Commission. This is crucial for the public opinion to, when we talk about our money. So this is extremely important. Last but not least, the message, no spending or no street caps. Yes, in principle, this could be one message, but please remember that yesterday in the conference on climate change, the young people asked the same, and probably tomorrow talking about immigration, talking about the crisis on Afghanistan, and some other will talk about no spending caps. And this is according to me, the exact contrary of the sustainability. But also the justification that we will provide to the politicians to not do anything. So we have to balance some message, and on the contrary, we can imagine what we can do, but probably we have the chance to talk later on about it. Starting also from the role of the European Commission, because, and then I finish, for many years we have too much listened. The European Commission required to member states to, for sure, to reduce the debt, of course, correct, to take under control inflation, okay, done, fine, but not too much the European Commission to probably encourage member states to double investment in prevention. So the narrative and the message and the way also the institutions communicate some key issues to the world public opinion, to the citizens in general, is crucial to identify in which direction we have to spend our money, our resources.
Thank you very much, Mariano. Let me just a follow-up question for my understanding. Do I understand right? You mean if we say no spending caps, this is handing to the politicians basically the permission to do nothing because it's impossible. Is that what did I understand this right?
is one of the risks is that different stakeholders in different areas that are priority for all of us ask the same request. And the risk is that we provide to them the justification, the excuse to not take any kind of decision. So very careful about this, because in principle, okay, it's more flexible, much more than no spending caps. We can better communicate also this aspect. And so this is, according to me, the perspective to take in consideration.
Yeah, thank you. I mean, I think I link to Tim's key message, and perhaps Tim, if you want to come on for a second, which was the issue of this budget should have a forward-looking element, and perhaps this qualification of these no caps thoughts of whether it's no caps or even if there is a capping. So please come in here with your thoughts from the study. Yeah, no, I thought Mariano's points on accountability is a good word, and it's one we should get into our slide. And the advantage today is we haven't finished this write-up yet, so we can steal some of the ideas. So I think that's a really important point. And Mariano, I think your distinction between the long-term nature of some of the technical recommendations and the short-term political decisions is exactly right. And so what we need is we do need to have prioritization and targets of how much we're spending on vaccines, and a commitment to aim to spend that money on vaccines. And we need to have transparency so we can monitor whether we do it. I suppose, and maybe we need to think about the wording here. We're just saying we don't want artificial caps that mean you get to October and you say, well, we shouldn't run the next tender on a new vaccine until the new year. And so we want to have some flexibility in the spending, because not everything, and this is, I suppose, one of the big lessons of the last 18 months, is predictable. We can do horizon scanning, but we still need some flexibility within spending. So I think I actually agree with everything Mariano said, and we need to think about the wording, because we agree, but it doesn't look like we agree. We need targets, we need transparency, we need monitoring. That gives you accountability. And but we don't want it to be an inflexible system of targeting, where we end up with this situation where we hit caps and we make bad access decisions. So we need to work on that wording very carefully. But Mariano, you've given us a lot of food for thought. While I'm on, I suppose it'd be interesting, and Dimi, I suppose this probably links to some of the discussion later on. I think I normally agree with everything Richard says, but I suppose one of the successes of vaccines in this first part of the session, we're just thinking about the current set of vaccines, leaving aside COVID vaccines, and I think one of the successes of the model is developing platforms and new vaccines. And we've got a very healthy pipeline of new vaccines, leaving aside COVID vaccines. So this question of public and private participation and how that links to the funding model, I think, is really interesting. And I suppose I would take a slightly different characterization to Richard and think the current funding model has worked pretty well, and that's how we had the mRNA platform. So it would be interesting to pick that point up later on. All right, thank you very much, Tim. We will come back to this for sure in the next round of discussion. I think now is an excellent point. We've heard from all our panelists and a wealth of different issues and to some degree different opinions. We go back to our audience for now, and we want to do that in two ways. So Ryan, I'll come to you to summarize for us what's going on in the Q&A and the chat. And then we have a short poll for us to reflect in the panel. I see there is quite a bit of activity, particularly in the Q&A. So over to you. What's the summary?
Great, thanks, Dimitra. So yeah, we've had a few questions come in, really thinking about how to really rectify and respond to the COVID impact. So I think we'll, as you said, we'll come back to that session a bit later. There was one really interesting question, thinking about, you know, when we're talking about funding vaccines, how we think about this from a more holistic approach to immunization financing to really ensure that funding actually results in patient access. So ensuring that not only vaccines are that are recommended are funded, but they also benefit from all the necessary enablers like infrastructure, monitoring to really ensure equity across Europe as well. So it'd be perhaps interesting to hear any thoughts from the panelists on that question. And then another key question, which is obviously viruses don't respect borders, and where countries have fragmented immunization policies, this could show weaknesses in some systems compared to others. So really, how do we think about ensuring a more coordinated approach to strong immunization policies from across Europe in general, so that all countries are really prepared and supported for what any public threats come our way in the future?
Excellent, thank you very much. I'm taking these two main bits. The COVID effect we will discuss anyway, and we have been discussing already. One is the funding, but also for the whole delivery of vaccination services pathway, and this idea of if only one country does it, doesn't mean that we are generally safe, so to say, because of the virus is not respecting borders. And thank you also to our participants in the chat and the Q&A for their insights. What we would like to do now, so we will take these points in the discussion for sure, but we also want to hear from you what you think the main barriers to sustainable funding are right now, to give us in the panel food for thought for the remaining discussion. You see a poll on your screen. What do you see as key barriers that limit sustainable funding of vaccines today? So it's in a way the reverse of the word cloud that we did starting our session. Pick your top 3, and the options are insufficient policy prioritization of prevention, vaccination, and we're linking back to what Mariano said here, misalignment between budget holders and access decision makers, budget sets according to past demands, lack of alignment of funding with public health priorities, focus on the annual budget cycle, not forward-looking multi-annual plans, and caps on vaccine spending. So we have 14 of you who have already responded. So take a moment to think your top 3. And of course, our panelists are also very welcome to vote themselves if they want. We have 2 maybe relatively clear favorites, with that being insufficient policy prioritization of prevention, currently at spot number 1, and lack of alignment of funding with public health priorities being number 2, followed closely by focus on the annual budget. But there is, with the exception of caps on vaccine spending, which is interesting because it was the one that popped up in the word cloud, but perhaps Mariano changed our minds. There is quite a bit of action for all the other options. And so I think here also very clearly we see that at least those of our audience who are interacting with us via the poll also see this multifaceted nature of the challenge, the way the panelists already reflected on until now. So perhaps we take the winner for now, this insufficient prioritization of prevention overall, to move into the next round of discussions, which is related to how we go forward from here on out. Of course, we're going to reflect on COVID-19 vaccinations, but particularly also generally about routine vaccinations programs and immunization as a whole. And we heard from our audience how important that is to consider. So if we ask you, our participants, to think about what the main lessons are from COVID-19, from the COVID-19 experience with relation to vaccines and immunization, that policymakers should take note of moving forward into planning how we proceed with vaccination in the next few years, what would those be? And we would like, this is not a poll, this is an open question for you to reflect in the chat while the panel discusses moving forward. We have about half an hour left in our session and we want to make the best use of it, including your participation. So we saw one being that prevention in general, what we heard from you until now as to barriers, is not highly prioritized, and perhaps then as a second number that the spending is not in line with public health needs. So if we go back to our panel, and I would perhaps like to hear from Raluca first at this point, You talked about the possibilities for using tools that are available from the Commission to help member states rethink and implement changes. So with this in mind, with the refocusing on prevention, also linked with the pandemic and what we've learned, what are the main lessons that our audience should take with them today about where the Commission and the EU can come in?
Thank you. Well, definitely the lesson is that we need to cooperate more closely and to cooperate on a regular basis, I would say, to think in advance, to try to have solutions for crisis moments. So you would have seen at the Commission level, there is a lot of focus and a lot of work goes into how to increase the resilience of the health systems, how to be better prepared for the future. The President has announced the creation of new agency to deal, so the Health Emergency Response Authority, so to deal with future crises. But beyond that, I would say, and thinking a bit of the remit of the service that I'm leading, I think what we can do is to maybe bring more often member states around the table to discuss issues, because I mean, vaccination and how to deal with it, how to integrate maybe COVID vaccinations into the national routines. I mean, these are issues that need to be discussed because of the impact on the budgeting side at national level and so on. And as I said in my previous intervention, I think we can accompany member states in carrying out this reflection, being at national level, so accompanying them on a bilateral basis, but also we're happy to engage with member states on a multi-country basis. And as of next year, actually, we're encouraging even more than in the past member states to together maybe a few around a common project. And this could be, I mean, thinking now out loud, this could be an area where like multi-country project could bring benefits, because member states would have the chance to exchange best practice, to discuss how to tackle such issues. Maybe I would just recall the fact that DG Reform provides support on an annual basis. So every year, member states have the opportunity to introduce new requests. And this year, actually, we invited member states to submit requests by end of October. So there's 1 month left for submissions of requests. And as I said, this can be in many areas, including strategies for vaccination going forward. Thank you.
I think this is very useful. Stay on, Raluca, for a second, and then I will go to Mariano, followed by Richard. But I want to pick up on the 2 points that we heard from Ryan, came from the interventions from our audience before. This idea of this holistic approach to vaccination. You mentioned the holistic approach to public health and prevention earlier. So just for me to highlight that if it's not just about which financing tool a country will use or how the budget will be set, even though this is the core of what we are at the core of what we are discussing today. But for example, if it is about how to strengthen national immunization programs, this also has to do with health service delivery structures at primary care level, who is allowed to deliver vaccinations, and also definitely to a degree linked to whether these are services that are in a statutory health system free at the point of service, or if patients have to pay cost sharing. So all these little bits and pieces come together to ensure that we understand that we have a national immunization plan that is accessible to patients. And so I think maybe important for us to understand from the DG Reform perspective the extent to which these areas are all areas that member states can come to you with questions or with requests to strengthen their health systems.
Yes, from our perspective, so we offer advice from more like strategic. So basically trying to to see how member states can develop a strategy. So vaccination, we can imagine now going forward, how to better, thinking of the various areas. So the cost, the access, indeed, very important. And then, yes, the strategic view, because we do not give funding, but also that is the funding part is like something that I mean, is to be discussed at national level. But I think through the focus on the access, the fairness, and then trying to prevent at national scale the different diseases, it's something where we can offer support. And as I said, part of any project is there a number of study visits, exchanges of best practices. So we, even if we work on a bilateral basis with a member state, we always organize these exchanges with other member states, because we think just having another perspective on how things work, hearing how others are organizing their strategies or how they put procedures into place is something valuable, because at the end of the day, I mean, everything can be adapted, and there might be sometimes good solutions that are not known because of, you know, the national focus and so on. So this role of facilitator that we have, so bringing in the views and expertise from different corners, is something that I think can be very valuable.
Yes, thank you very much. I mean, this is this platform for exchange and collaboration. We saw very important among the criteria. Is really important. I think, look, at the other thing to point out is that this is what digital reform does, but there are many different support tools that the EU has for its member states. We here at the Observatory have been working on an overview of these tools, and while you do not provide funding for infrastructures, for example, there are tools within the EU framework that are available to member states if they need to strengthen primary healthcare, for instance, within which vaccination programs might be delivered. This is also an option. It's just a matter of understanding what you can use for what. But so I thank you at this point. We come back to you later on. I pick up this thread of working together, the European perspective, and moving forward. And Mariano, I come back to you as warned, just to build on what you told us earlier and where you see that we can go moving forward based on the experience that we've had so far.
Yes, talking about cooperation and probably also talking about participation in a concrete way. And I want to provide my perspective that is totally aligned with the European national institutions. I totally support, of course, the vaccination. But in a concrete way, the European Commission has already approved the most of the national recovery plan. Italy, as you know, has received the most of the economic resources among the member states, and in Italy, 9% of this budget is focused on health. Can we cooperate together in order to identify among each national recovery plan in the chapter on health, what about the program and the project focus on immunization that will be financed? Who is aware about this point? Who is aware? The European Commission, the member state. I just remember that the resolution of the European Economic Social Committee last February announced that the level of participation in the recovery plan for the civil society was, of course, not enough. So when we talk about cooperation, we agree, but I'd like to propose something very concrete. Can we together identify in the national recovery plan which are the projects to be financed in my country, in your country, in each country across Europe, focus on immunization, focus on vaccination? This is key, because if we identify some activity, project to be financed, activity investment in terms of course, increase vaccine coverage, we can follow, we can be much more aware, we can also provide suggestion to the ones in charge to the implementation of the National Recovery Plan. And this is, according to me, valid not only for the civil society, NGO, etc., but also for the private sector, for all the stakeholders involved. So, for the European Commission, this is a request to try to identify how we can cooperate to identify in each member state concrete initiative to be financed at national level thanks to the Next Generation EU, focus on vaccination, and then to follow.
Okay, so let me just be 100% clear. This is about the recovery funds from the resilience and recovery, the recovery plans from the resilience and recovery fund, correct? So this
yes,
is
that is yeah.
Funding, new funding opportunities arising from the COVID-19 pandemic and moving forward.
Yes, in terms that the recovery plan is our main opportunity also towards a more resilient healthcare system that cover different aspects, but there are one chapter and a specific budget in Italy, 20 and more billion euro, focus on health with some key point. Can we together identify and suggest some priority in terms of implement and use this budget also for immunization? Who is informed about the project, the activity to be financed thanks to this recovery plan? This is probably a field of action common for all of us, for all the stakeholders.
Yes, and this monitoring, which I think I agree is a very important knowledge to have what is going on in this area. This links to the goal of ensuring A, equitable access, and B, ensuring that strengthened immunization systems in all European countries make everyone in Europe safer. Or I'm trying to understand to make sure that I understand the perspective correctly.
We can say that the recovery plan allowed the member state to overcome this crisis in different sectors. As you know better than me, one of the chapter is focused on health for more resilient healthcare system. Each member state has defined some priorities. This the engagement of the civil society, but also the private sector, it was not enough in the definition of this kind of priority. Now we have the last chance, not only for us, but also for our for the next generation, to identify the better way to use and so to use the money so that to implement this recovery plan in each member state. Each one of us, different stakeholder, can play a role, starting from the information. Who is informed about the concrete initiative that will be financed by public money? What about this initiative will be focused on immunization? If we can not just talk about in theory of cooperation, but in practical ways, the recovery plan is the field of action.
Yeah, okay, thank you. And I think this is also a very important link to accountability, Mariano, that we talked about earlier, so that this issue of monitoring and understanding and driving forward. So I thank you very much. I go to Richard, as promised, Richard. And perhaps we link to what Mariano has just been talking about this idea of using the recovery plans to move forward. You mentioned earlier different approaches to vaccine funding, not as reactive as before, perhaps what we've learned from COVID-19. So would you elaborate on that a little bit, based also on what you've heard from our speakers until now?
Yes, no, very, very good conversation. So first, I just want to, loop back to the comments from Tim, commenting on what I said. I think that we both share the view that you will need to have a vibrant, largely privately funded life science sector to drive the foundation research, okay? So that's clear. With mRNA, for instance, I mean, the company called Moderna, I knew about Moderna. You probably did as well, Tim, and a few others, but I guess most people have never heard of them. But those in the sector knew that they were out there. They've been doing research for years into a particular technology, mRNA, which is now, household language. Everybody talks about it, okay? But I do not think that neither Moderna, and particularly not Pfizer, is stepping in to partner with BioNTech. I don't think that would have happened if there wasn't that the fact that the governments put money on the table, both in terms of cash and in terms of a commitment to procure, right? So I don't think one thing excludes the other. No, my observation right now, listening to the conversation here, is that vaccines have largely been viewed as a commodity, particularly seasonal flu vaccines, but also the other ones, And I think I see what we see now is maybe an acceptance, or the beginning of an acceptance, that the prices for vaccines and medicines are not based on production cost or even development cost. There's something else in it, there's a value component. And particularly if you want to reward innovation, particularly if you want to stimulate new developments, you have to accept that people need to make a profit. Our own pension funds are the ones that need to make a profit that we will benefit from. Right? So I think not everybody agrees. I take all these questions from the press all the time about, how can it cost 15 euros in average maybe for a vaccine dose? I mean, clearly can't cost that much to produce it. And by the way, you injected hundreds of millions, didn't you, from commission money from this SE fund? Yeah, we did. But we all agreed, all the EU member states, together with the Commission, we accepted that there's something else here. It's not just the question of pricing based on manufacturing. So I think that's very important. It's extremely important for this sector. And I also think, as a message to my colleagues in the industry, in the private sector, maybe you shouldn't be so afraid of government action. I used to be against or cautioning against joint procurement. This was the thing that the industry was fearing the most. Okay, well, now the EU did joint procurement of vaccines, and guess what? People are making money. We paid fair prices, not ridiculously high, but still, above development and manufacturing costs. So I think this is really, of course, I'm biased. I've been completely entrenched for the last 15 months in this vaccine work, but I think there's something to build on, really, both in innovation procurement, in articulating what is needed, and then also the fact that, if you want to have innovation, if you want to have a vibrant research sector, you have to pay a bit. It can't cost €3.12, per seasonal flu vaccine shot every year. You can't do these tenders anymore. We have to learn from that. You're not going to get any innovation if everyone's just concerned about price. And I know, Tim, you agree with me on that. Over.
Thank you, Richard, and thank you also for creating the bridge to Tim, who was going to be our next speaker anyway. Tim, if you want to reflect briefly, because then I have a final question of my own, and then we have a final look at the chat and what our audience contributed before closing. So Tim, reactions to our speakers, and particularly to Richard, who called on you?
And it turns out we don't disagree after all, so I agree with what Richard just said. I think just to emphasize a couple of points. I think one of the lessons from COVID was the funding wasn't just about the vaccines, it was about the administration and the awareness. So we did see it as holistic spending. And I think if we can pull that back into vaccines more generally, I think that's a very useful thing for us to do. Just us being willing to mobilize that degree of funding. COVID is obviously exceptional, but if we can keep that idea of the social value of vaccines and immunization and build that into national budgets, that's going to be tremendously useful in terms of that prioritization point and how we deal with new vaccines. So this idea of ring fencing COVID budgets is interesting. Most countries chose to ring fence them, not all. Some countries integrated it into their overall budget. It will be interesting to see that play out. And I wonder if the countries that integrated it into their overall budget, that might help with vaccination more generally, because we will, instead of the budget COVID boosters being seen as competition for funding, we're actually, as COVID vaccine spending goes down, we will see, well, we can use that money to put into other vaccines. So it'll be very interesting to see how the ways that countries dealt with the emergency funding and how that plays out. And I think that there's a very useful role for the Commission in helping different countries think through that reallocation of funding so that the national immunisation plans do not miss out. We need to invest in those given some of the reductions in coverage rates and that we've seen over the last 18 months. I don't disagree with Richard.
Okay. Let me just comment briefly. You just said, you know, as spending on COVID vaccines goes down, if we have integrated the vaccine budget, then we have room for more spending on other vaccines, if I understand like the math of that correctly. But at the same time, as you mentioned, I think earlier today, there is this worry that until COVID-19 vaccine spending goes down, it might actually squeeze funding for other vaccinations. And so that is also something to keep an eye on. And I think perhaps we link it to what Mariana was talking about, this really important opportunity that we have now through the recovery plans to actually take new steps in this direction, and the importance of monitoring and bringing in your study the importance of cross-country learning for understanding that, okay, if we did this and now this means that we have trouble with delivering our routine vaccinations, then maybe we need to change this model into this other decision-making model moving forward to do not have this challenge anymore. Let us go to the audience one last time. We have 5 minutes. So we will hear from Ryan what's been going on. I see there's quite a bit of activity, and then we'll have an opportunity for closing comments from all of our panelists before we say goodbye. Ryan, over to you.
Yeah, so a couple of comments, I guess, really built on some of the last statements that were just said. So really around, you know, the value of vaccines and how, you know, the pandemic and the impact of COVID has really highlighted the societal value that vaccines do have, and, you know, the real implications of the absence of vaccines in society. So really making sure that that we have this appropriate valuation, and then this translates to appropriate funding as well. And then I suppose a bit related to that is, you know, how we've seen some underinvestment in vaccination programs across countries, which has contributed to gaps or delays in the successful rollout of the COVID-19 vaccine more recently. So that we really need to think about, you know, both strengthening supply and access through sort of as we discussed earlier, a holistic approach of coordination, monitoring, and really thinking about how strengthening routine immunization programs results in better pandemic preparedness in the future as well. So we're really combated against whatever future public health threats come our way. And then finally, really thinking from I suppose more from a policymaker perspective, that prevention is really factored into, you know, a key priority area of the government's programs, and really thinking about the broader benefits of prevention. So I suppose a bit outside vaccination, but really the impact that vaccination has on prevention, and, you know, the healthcare benefits of that as well.
Excellent. Thank you very much, Ryan. A lot of food for thought and several points we have picked up in the panel already. We have the opportunity for closing comments from our panelists. So I would like to start with Mariano, go to Richard, then go to Raluca, then finish with Tim to close the circle. Mariano, over to you. You heard the audience's inputs? Yes, go ahead.
We have to move from the paradox. Even the prevention should be high priority for all of us. Over the years, the budget expenditure for prevention is still at the end of the list of the expenditure, only 3%. This is the paradox that we have to move, and probably we have to invest in what already was suggested in the chat, in the social value of the prevention, the social value of immunization, and the positive impact that vaccine over the years have produced to the community, to the society. And to do so, we suggest greater participation for all the actors, including the citizens and patient advocacy group organizations. Thanks.
Absolutely. I think the stakeholder involvement, as you say, citizens, patients, very important, Mariana. And I think if not investing in prevention now, after our experience in the past 18 months, then when? I think maybe now, it's really the time to push. And so with that, Richard, over to you. Final comments for today?
Yeah, no, so Dimi, I just want to build on what you just said. I mean, I couldn't think of a better opportunity for anyone working both with vaccines, but in public health in general and with prevention, to seize the opportunity. We have seen how, at least here in Europe, the European governments, as I've said earlier, have bought more than 3 billion doses of vaccines, and actually with options for another billion, okay, which we will share with the world, okay? And somehow we break out of that budget. Somehow, we found all that money. An average price, maybe 15 euros, just make 3 billion times 50, that's a lot of money. So we broke out of that budget. All the ministries of finance, and I can mention that my own Minister of Finance in Sweden, who probably will be the next, maybe the next Prime Minister, by the way, she speaks all the time about this. She couldn't think of anything that's more, anything better use of money right now than COVID-19 vaccines. Mm-hmm. So somehow people have woken up to the fact that vaccines, prevention, health is more important than anything else, okay? It keeps the economies open. It's a fundament. So I think, we have a golden opportunity, all of us, to make sure that, whatever we achieved in this huge mobilization, both money-wise and innovation-wise, that we hang on to that. Let's not, as they say, I know we don't like this term, no, never waste a good crisis. Now, let's not waste this one. Let's build on this. Thank you.
Thank you very much, Richard. And thank you also for pointing out this cascade is very important. Sustain more investment in health in general, public health, prevention, and vaccines in particular. So I think this builds in very well. Raluca, we come to you for final comments from the perspective of what you do.
I'll be very brief and agree with Mariano and Richard that prevention, this is the key word, and we need to learn the lessons from the crisis. And I mean, speaking not only for reform, but Commission in general, because DG Santé is leading the work, and of course, we are supporting them. So we are committed at the Commission level, I would say more broadly, to supporting member states and to ultimately support the citizens in having better care and better access to medicine of all sorts and vaccination in particular. Thank you.
Thank you very much. And I think we are all crossing our fingers that this works as well as possible in the next few years. Tim, over to you to conclude the session in its entirety. Not a little weight on your shoulders at the moment.
Even so, I will be very brief because I know I'm between people and their cup of coffee. And fantastic amount of feedback and reaction to some of the framework we set out. We will take this on board. It's not finished yet, so this has been super helpful for us. There's 2 words I've written down and underlined a couple of times that are not in our principles, but clearly need to be: equity and accountability. So thank you for everyone's comments today.
Thank you very much, Tim. I would add this another word. I mean, not holistic as a word necessarily, because it can mean different things, but this idea that vaccinations and vaccines themselves are part of an immunization program. So while we need to invest in vaccines, we also need to see it from the overall perspective of delivering these vaccines to patients within the health system. Thank you, Tim. Thank you to our excellent panelists. Thank you to you for joining us. We wish you a very nice remaining couple of days at the European Health Forum Gastein this year, and see you again next year, hopefully actually in Gastein. Goodbye, and thank you for joining us.